thank you in the name of my students, which will be class 2014. Thank you very much. If you have any questions, I'll be glad to answer.
Starting a new school from scratch. Questions for the dean, founding dean.
I commend your tremendous efforts to achieve such a wonderful goal.
Thanks.
And I'd like to ask you how you will determine if your goals have been met. Do you think that you have been successful, and what outcomes will you look for to see if you were successful?
In the first 2 years, we were just measuring the amount of students. You know the grant is going to be over someday somehow. But you could see that we were admitting 121st, then 150, and this year we will be admitting only 80 students, and our commitments will be different than the amount. Will be assessment, will be quality, will be academic advancement in medicine. We are working on that. We have standardization of some kind of exams that the country is asking us to do, but my goal is that when my students graduate, they could, without any additional course, they could pass the first step, the USMLE. That's my goal. Our goal, I'm sorry.
Rodolfo?
Yes?
Over here.
Okay.
So I just want to go back to a piece. I'm sort of in a similar process, only I don't have to establish the school part, just the program. You took in students, so when you were doing your curriculum sort of design, that methodological level and instrumental level, you said that you had students actually part of that process, so were those the high school students that then ended up matriculating into your, like being admitted into your program?
They were, in the first year, we were still working in the curriculum, and then we were just adding the students in the stakeholders and the
So they were actually a stakeholder in helping develop your
yes,
process?
They were developed.
And then did you have any students that were from the other medical schools in your city actually part of that process as well?
One of the things that we received in the first year was a very huge group of medical students from the other two universities that I mentioned, like from the 120, maybe 80. And we accepted them because we understood that they wanted to have a better medical education and they were looking for something better. But now, in this year, 2010, we just stopped there. So there are no transfers, no validation of subjects, just brand new students this year. Yes?
Just Sean. Okay, thanks. So I was talking with you briefly over breakfast, and I think what took my breath away completely was the fact that you have people starting at different times throughout the year, and I can imagine, I don't know of any medical school that can accomplish that, so can you say a few more words about that?
We have some advantages. For example, we have basic science teachers that are also clinical teachers. How come? In Ecuador, you cannot be a 100% basic science teacher because the salary is not enough. So you have to go to the hospital, you have to go to your office, you have to see patients, and then you have to study more, and you have to become basic scientist and clinical scientist also. So that's an advantage because we can use them for both things, and they are perfect to integrate basic science and clinical science skills. So starting the first year, students just could go to the hospital, and if they are studying, for example, emphysema from the lungs, they could see a patient with that problem, and they could see the signs without touching the patient, of course, but just observing and making a match between what they are learning and they are going to learn later. And second, as a liberal arts university, we had a lot of entrance dates, like 4 or 5 in the year. The thing was, if they were entering, for example, in January, they were taking some subjects. The group that was entering on May, for example, they will be taking another subjects, and then we will have at the same time first-year students, second-year students, and third-year students at the same time in the same year. So if first-year students are willing to take a subject that does not have any requirement, they could be able to do so, and they could just win time in their career.
Multiple intakes is the question, and I find that fascinating that most American schools and Canadian schools don't appreciate that the history of the European school and many of the Latin American schools is that they take a class twice a year, and that in many, actually the Caribbean schools that are the for-profit schools, there's an entry 3 times a year. So, and in some of the classes, for example, if you were to go to some of the Latin American schools and some of the European schools, the classes might be up to 800, 1,000 students. So when we talk here in the United States about, oh, woe is me, we can't take 10 more students next year because the anatomy lab can't handle it or our lecture hall isn't big enough, I'm always sitting there thinking, these people just don't know what it's like in other parts of the world. Right now, Munich takes 880 students, and they do a patient-doctor course for all students in year 1, where they're placed with clinical preceptors in the city of Munich. So, I mean, that's why it's so important for us to have an international mix here, so that we begin to challenge our own assumptions, behaviors, etc.
Actually, we have classes of 25 students. If we have, for example, 100 students that are coming in the first entrance, we just divided that 100 group into 5 classes. And it's very easy for us just to get 5 very qualified teachers just teaching those little groups. Even those little groups, 25 students, they just split in 8 students or 6 students little groups to make the PBL learning. Mm-hmm.
One more question, Holly?
So I was going to ask about how this was received from the student perspective, but I think you answered that by saying that like half of the other medical school's students wanted to come to your school. But I'm curious about what you're doing for faculty development and faculty recruitment. Did you actually, were these like all new faculty who just wanted to be part of something new, or were they people who were also dissatisfied with the way things were going at the other schools in Guayaquil or throughout the country?
I discovered something. I discovered that having a 25-year faculty, I mean not 25 years old, 25 years experienced faculty, compared with a brand new faculty coming from the United States, graduating here with a fellowship, I'd rather to have the second one. Because it's a very hard task to make that 25 years experienced faculty, to use Blackboard, to make PBL, to get into development, you understand. So I'm trying just to get all those precious jewel faculties that are coming to my country, graduated from the States, and finishing fellowships and all that, and just being there to practice. And I just invite them to join me this project and just to convince them, just let's go to this project. This will be amazing after 5 years, and they are just inside of the project immediately.
So are these people who are Ecuadorian and are returning home, or are you just recruiting lots of international faculty?
Most of them are Ecuadorian, but we are just having a plan to offer retired faculties from all over the world just to go to this beautiful country.
Do you take people on sabbatical?
Everything.
I think you see a few eager participants here.
Yes.
And these people would have, hopefully by the time they're completing all their thinking here with us, the kind of culture and mindset about education that you're looking for. So let me join in thanking Rodolfo. And the good news is so I'd like to just take 1 minute or 2 minutes for some very quick announcements before you break. First, Pratt has asked that during this break, and you'll have a good 15 minutes, he would like to meet with 5 people in the class in preparation for his session after this. So Christian, Carol Capella, Deborah Boyer, Curtis, and Meaning. If you wouldn't mind